As area hospitals grow closer to capacity, Austin's top doctor says some patients with COVID-19 are not being counted. This is important as bigger numbers could mean more restrictions or even a local shutdown. KXAN investigator Kevin Clark is asking what went wrong.
On Monday night, Austin Public Health said its 7-day average for hospital admissions was just under 65, but the city's top health authority now says the count is too low.
The data we have in hand now suggests that we are over the 70 for admissions on that 7-day moving average.
That was an update Dr. Mark Escott gave to Travis County commissioners. He said some patients admitted who were found to be COVID-19 positive later on were not being counted.
So we're still doing a little work on this to determine if the numbers are accurate, and we expect to update this on the dashboard tonight.
Our area is in stage 4 based on current hospital capacity and has certain restrictions for that level. But we could move to stage 5 depending on the latest numbers and how fast we get there. Stage 5 could restrict only our area to having essential businesses open.
Since last month, our investigative team has repeatedly asked hospitals to provide a clear picture on their capacity and staffing numbers. Even frustrated local leaders trying to prepare for an overflow in patients repeatedly pressed hospital CEOs to provide their capacity numbers since March.
Austin Mayor Steve Adler says the data snafu was not because hospitals were underreporting numbers. He said Austin Public Health had been juggling different hospital data and for the last week hadn't included the additional patients in its dashboard.
From day to day, you could tell how much the number was going up. You could also see the new admittances in the hospital, and they weren't adding up.
Adler has said we're just a couple of weeks away from reaching hospital capacity. He says an overflow hospital at the convention center, if needed, would be available after July 21st. Kevin Clark, KXAN investigates.
Do you work for a hospital in Central Texas? Do you have coronavirus-related concerns the public should know about, but your bosses might not want to get out? The KXAN investigators are digging into those problems. You can find a secure form to send us a tip at kxan.com. Just click on the coronavirus tab. That's where you will find all of our hospital-related stories.
The number of active hospitalizations statewide has grown to almost 9,300 Texans. That's an increase of almost 600 patients in the last 24 hours and a 42% jump in hospitalizations in 1 week. And for the first time, Texas recorded more than 10,000 new cases. Part of the reason may be that some counties reported 3-day totals from the holiday weekend.